recording is happening.
All right, so welcome again to Communities of Opportunity, our info session on our request for applications, learning from community stories, the impact of COVID-19. I really appreciate everyone being here. We want to, and again, my name is Cristina Gonzalez, Program Manager with Communities of Opportunity, and I will be helping to support some of the facilitation for today. We can go to the next slide. We want to begin today's session with land acknowledgement. We gathered today on the ancestral lands of the first people of Seattle, the Duwamish people, and we honor with gratitude the land itself and the Duwamish tribe and all the Native people who call King County home. Next slide, please. So to help us with our presentation today, our info session, if you could sign in with your name, pronoun, and organization, and I use she, her pronouns. Please use the chat or the hand raise function to submit any questions. Please type any questions in the chat. We do have a lot of information that we're interested in sharing, and we'll try to pause if you have a question in between the session. And we may be at a point where we might hold off on questions until the very end to make sure we have all the information. If you could also keep your phone and headset muted unless you're speaking to the group. And we usually have closed captioning capabilities, and we apologize if we're not able to do it live for today's session. Captions will be on the video posted afterwards. And if folks are interested, we can offer another session specifically for folks that need closed captioning. And I'll add that to the chat as well. And would like to introduce our team now. And we can, I already introduced myself. Kai, would you like to introduce yourself?
Good morning. My name is Kalayaan Domingo, and I am a staff with King County Public Health and with Communities of Opportunity. I am the lead for the learning community, which is one of our strategies in Communities of Opportunity. And I will be here helping out in the presentation today, sharing about the RFA and partnering with our other team members.
Thanks. Vanessa, you share us who you are, what you'll be doing today.
Thank you. So my name is Vanessa Quince, and I am a social research scientist for Public Health Seattle King County and the Assessment Policy Development and Evaluation Unit. And I also work with Communities Count. I don't know if some of you have been to our data capacity building workshops where we talk about like logic models, focus groups, and survey design with our community partners at COO.
Thanks. Chris Diabro.
Hi, I'm Chris Diabro. I'm the contract specialist. I support all the Best Starts for Kids county funded contracts, which would also include Communities of Opportunity.
Thanks, Chris, for joining us. Lynn?
Hi, everybody. My name is Lynn Knapp. I'm just here with the COO team to offer tech support and note-taking. So if you have any tech issues, feel free to just go ahead and send a chat to me directly and I'll help you out.
Great, thanks. Thanks, everyone. Kai, would you like to share with us what COO is about and start off the presentation?
Great. So Lynn, go ahead and next slide. Great. So today I'm going to give you just an introduction to Communities of Opportunity. If this is going to be a short overview of Communities of Opportunity, and if you wish to learn more about our work, I'm going to have Christina drop the link to our website, and you can learn more on our website. We're going to talk about the funding opportunity, the COVID-19 stories, and we're also going to be doing an overview of the COVID-19 data. Vanessa has been working on that as part of her work, and we'll be guiding you through what data exists and how we're going to be using that data in our prioritization of applications. We are also going to be sharing what our vision is for participatory research and community engagement so that we can have a shared frame for the language and the approach that we're using, and hoping that will be in alignment with the ways in which community is also thinking about what participatory research is. There will be time for us to talk about this after our presentation or during the presentation. Feel free to write questions in the chat and to stop us along the way. And we really want to also have a conversation about what this potential project is. We'll be talking about some of the application specifics, and then we'll have that time for questions. So Communities of Opportunity is a community-driven initiative. We've been working on this since 2014, and we work in partnership with the Seattle Foundation and two departments within King County, the Department of Community and Human Services, as well as the Public Health Department. And our goal is to work in deep partnership with community to increase health, social, economic, and racial equity in King County so that all people can thrive regardless of race or place. We do this through, actually next slide. We do this by looking at our 4 result areas, which is that all people in King County have the right to thrive economically, have right to quality, affordable housing, are connected to community, and are healthy. We look to our partners to identify what the challenges and strategies are that they're working on in their communities, and we have a focus on policy and system change. We believe that we want to change the structures that are producing these inequities, and it's through the community-driven solutions that we'll be able to create the King County that we know where everybody can thrive. We also recognize that there are disparities in King County, and we focus our resources to go to those communities who have really been impacted the most because of these inequities. Next slide. We do this through 3 strategies. The strategy that we have this RFA under is our learning community, which is actually one of our newer strategies. And the learning community is really a big umbrella for the ways in which we can learn together as a community. We can build critical connections. We can work on capacity building, both field capacity building, leadership capacity building, organizational capacity building, and then equity innovations. What are the solutions, the models, the practices, the organizations that we need in order to really be successful in moving equity forward in King County, not just in this moment, but for long-term equity. The learning community impacts our other 2 strategies. So we have a strategy that is funded through our work in the Seattle Foundation, which is the institutional policy and systems change, and really looking at what are the root causes of the inequities and how do we partner with community to change those root causes. We then work with 9 place-based and cultural communities throughout King County as well to look at strategies that are focused on specific communities and driven by those communities that are connected and deeply embedded. I do want to say that we have a frame of racial equity in all of our work, and we work with our community to be supportive of community-driven efforts, which is a lot of what we're going to talk about today is the importance of hearing directly from those community members that are most impacted and gathering their stories in order to be able to design the solutions. So next slide. So our RFA is about learning from community stories, particularly through the lens of COVID-19, but we also recognize that COVID-19 is really just the opportunity to see how deeply embedded inequities are in our community. They are exposing the inequities that we know have existed and are bringing them to light in new ways. And we are looking to partner with community organizations or teams to gather those stories in order to move to build the solutions. We have seen data and studies that come out of institutions, and we recognize that there's gaps in what those what that data tells us. And we've heard from our community partners that community wants to have ownership over their own data, and that there's nuances that our data that we're collecting as health departments or as institutions or as those outside of communities are not always accurate in telling, and they're not always able to identify what the solutions would be if we were looking at it from those that are really living through these stories. So we believe that if we can capture the stories of community, community is empowered to collect and to build solutions that will actually be working towards ways to interrupt the ways in which we see inequities in our community. Next slide. So I'm going to go into some of the details about the RFA. So again, this RFA is the opportunity to provide resources for groups to tell the stories of the pandemic by collecting and analyzing data related to health, social, and economic impacts, and then to develop some communication materials. So we want to be able to share this information, and the communication materials can be identified by the applicants. We don't necessarily have a specific material that we're looking for. It's really about what's meaningful for the community and who the audience is that you want to tell your stories to. There is only 400,000 available. This is sort of a pilot for Learning Community. I hope that we can continue this work and we can continue to fund really this data collection and storytelling. A lot of the work under Learning Communities is a test for us to see how it goes, what the response is, and then we can build this out. So unfortunately, we only have 400,000 available right now. We anticipate there will be 4 to 5 awards, not to exceed 100,000. So groups can not apply for the whole 100,000, depending on the scope or the size of your project. So there is the potential that we may have more funds available depending on how much each application requests. The contract period is going to start November 1st. That's our hope. Sometimes it takes a little bit longer to go through negotiations. If you've worked with King County, you know, there is paperwork involved in contract negotiations, but our hope is that we can just get started November 1st, and that projects will be completed by December 1st. Again, the projects can define your own timelines. But we are part of the Best Starts for Kids initiative, and all funding under BSK must be spent by the end of December, which is why we are suggesting that projects must be completed by then, but contracts likely can be held until the end of December. Next slide, please. So I'm just going to quickly go over the deliverables and activities that are in the RFA. Hopefully you all have read the RFA and have seen it. Christina, if you would also drop that link into the chat box, then if you all want to follow along with the RFA, you can access it there. So there will be some standard deliverables that we will have for each of the projects: a project plan, community engagement, methods development, how are you going to be collecting your data, the actual data collection, the data summary, which is the analysis of the data, the communication, and then the actual sharing. And so depending on your approach, those things may look different. You may collect your data in a different way. You might summarize it or develop communications materials that look different than the other projects. But these are the standard things that we will want to see in every project. We also in Learning Community have a commitment to shared learning across projects, because we are hoping to build critical connections and peer connections and really thinking about how knowledge can be shared. We want to have regular cohort meetings with the selected projects so that leads or participants can be sharing with each other if there's challenges that are occurring. How can you look to your community of people that are working on similar projects to learn from them and share resources and build relationships and connections. We really want to see that there is the capacity and community to continue to do community driven research, and there are resources that are in community to be able to share them with each other. We know a lot of that work is already happening, but want to provide support for these projects. There will be staff that will participate in these cohort meetings, as well as the potential to bring in some of our community accounts or APDE staff, such as Vanessa, who is going to be presenting in just a few slides. And I see some things happening in the chat. Christina, is there anything at this moment that is relevant to answer?
No, we're good. Clarifying the timeline.
Great, thank you.
Great.
Okay, so who can apply? So really we have a couple of things that we want to see in a strong application. Groups that are uniquely situated within the community. The emphasis is that the relationship already exists. Because of our tight timeline, we really need to make sure that relationships are already there, and that ideally the people who are collecting the research are within the community. The hope is that this research is driven by those that are most impacted and have deep relationships. We also want to have a clear research question. Again, we realize that with community-based research, this isn't ideal, because whereas in community-based research, it's often you're going to community and generating that research question together. Because we have such a tight timeline, we do want to see that there's some research question already proposed. Again, there could be a process while you're working with your community to work through that question a little bit more deeply and to really think more about the priorities within that question. So the question may change from application to when you actually start collecting the data, but having something already identified will really make us, will be clear to us when we're looking at the applications that you've thought about it and you have a solid idea of what the question is. We also will want to make sure that there's a lead staff person who can support the successful completion of the project. This is, again, similar to the timeline. We don't have a lot of time for projects to get started and then look for support. So having somebody already identified is going to be really helpful. So who can apply? All kinds of organizations, but these are just some of the descriptions: nonprofits, community-based organizations, coalitions, tribes, faith-based organizations. We encourage teams to apply as well, but with our contracting, we will only award one contract, and then there will need to be subcontracts. So this is a competitive process, and we recognize particularly that there is a lot of interest in this and a very small amount of funding. So I want to point out that there's two prioritizations. One, that we really want to, again, center the work that's being led by and for community in which the research takes place. And then actually, I'm going to switch over to Vanessa to discuss this second prioritization. And then Vanessa is going to take it from here and talk a little bit more about the COVID-related data that we are going to be prioritizing.
Thank you, Kai.
Thank
you, Kai. And yeah, so I'll just talk about like the data around COVID-19, where you can find that data, but then also what are some of the data collection methods and tools. And like Kai said, like I want this to, ideally, this is something that's like interactive. So please take time if there's something that I'm not clear on or something that you need further explanation, and we can take a step back and I will explain it. So one of the things with the competitive proposals is that we want to prioritize communities that have been most impacted by COVID-19. And as Kai said, and I kind of switched in my notes, COVID-19 is just an opportunity to see how deeply rooted existing inequities are. So although we are paying attention to these specific metrics, so health, so access to healthcare, so the percentage of uninsured. So if we think about COVID-19 testing, and if we think about like follow through COVID-19, certain communities have not been able to access those resources due to lack of healthcare. And then also poverty rate, right? So thinking about the fact that like certain populations who we deem as essential workers, they've been the ones that haven't had the luxury to sit back, work from home, and not use public transportation, and still be working in some of these like congregated spaces. They also tend to be more impacted by COVID-19. And while health and access to healthcare and then poverty rate, they look at the root symptoms, ultimately how COVID-19 has manifested in our communities have impacted certain communities at higher rates than other communities. And then that is, these are the three areas that we will be looking at for the metrics, but also, once again, because this is an opportunity to see existing inequities, if there are other data points that help to highlight which communities are being most impacted, please feel free to use that in your application as a way to inform your research question as you move forward. So with that, Lynn, I would like to, if you could give me sharing capabilities. Thank you. And I just, okay. So everybody, do you see the Vulnerable Communities Data Tool dashboard?
Can I pause real quick? So
Yes.
other question, if the slide deck will be available afterwards?
Yes, we can make the slide deck available on our Communities of Opportunity website. I also want to make sure that everybody knows that this recording will also be there.
Okay. Anything else, Christina? Christina, were there additional questions?
Yeah, no, we're good.
Cool, thank you. Okay, so this is the COVID-19 Vulnerable Communities Data Tool. And I would say this tool kind of looks like what are some of the underlying factors that make certain communities more or less likely to be at vulnerable risk for COVID-19. And I don't want to overwhelm you with the data, but there are several different ways. We talk about, if we think of the Center for Disease Control and how they talked about like older adults being more vulnerable to extreme illness. And then we have the high risk and health conditions. So if you have pre-existing conditions, you might be more likely to experiencing severe illness as it relates to COVID-19. Race and ethnicity, as we see, like the same patterns that exist nationally also exist locally in terms of like communities of color, particularly Black, Latinx, and Native Hawaiian Pacific Islander. Those groups tend to be more affected by COVID-19. Poverty, language, and access to healthcare. So this is the one that I'm actually going to navigate right now. So if you click on that, so the website, and I will put in the chat box later on, is communitiescount.org/COVID-19/vulnerable. So we go to poverty and access to healthcare. So here you have several different indicators, right? So here are one of the indicators. So you have household income, that means less than 200% of, I forget what FPL stands for, but federal poverty level. So under 200% of the federal poverty level, that's an indicator. The percentage of uninsured, so that is 18 to 64. So these are the two that we're gonna toggle between. And you can select the different measures. You can select the number of people, or you can select percentage of the population. So just to keep things streamlined and just focus on one indicator, I'll just focus on percent of the population for both of the indicators that we will look at right now. So please, typically our website tends to have a lag, so please be patient with me as the icon just rolls. All right, so here we have percent of the population, right? So these are the cities and areas with the highest percent of population with the household income of under 200% federal poverty level. So here you can see on the right side of the screen how we have it broken down by geographic region, right? So if we see like Beacon Hill, Georgetown, and South Park, where you have 36.5% of residents have below 200% the federal poverty limit. And then here you can just like go down and see how this ranks along different cities and areas throughout King County. You can also hover along the map in order to get some of that. So we go from lightest to darkest purple. So darkest purple we have here, and once again, SeaTac Tukwila, that becomes one of the cases, one of the cities and areas that you might want to highlight in your applications as one of the groups that we may see some of the most vulnerable effects of COVID-19 within those communities.
Vanessa, we have a question. Where
Yes.
can we find the document on the federal poverty level?
I will look that up for you. That's something that's just like, this is not something that like we do locally. It's something that's more national. So I'll find I'll find that information and put in the chat box once I go through this data portion, if that's okay.
Great, thanks.
Of course.
Vanessa, if you don't find it by the end of this, I just want to let everybody know that any questions that are asked here today or information that we say we're going to follow up on will be put onto the King County Procurement website as an addendum. So any questions that are asked between now and there will be a final day of asking questions, all of that will be uploaded, so you'll be able to receive that information. And we'll talk about that at the end as well.
Cool. Thank you for that disclaimer, Kai. And we can also, it's not about like geographic region, but it's also the different percentage of individuals by race and ethnicity. So we have Alaska, we have American Indian Alaska Native being 45% of the individuals that live below the 200% federal poverty level. And then you can see as it goes by group. So once again, these data tools are just to inform whether it be your research question, but also as used to justify like why you're targeting specific populations. So we have, and then now we have uninsured ages 18 to 64. And similar to the right of the screen, we have North Highline, that tends to be the city area with the highest percent of adults, 18 to 64, who are uninsured. And thinking about how uninsurance rates or access to healthcare actually compounds with COVID-19 and the trends that we're seeing within our community. And similar to the federal poverty level, we can hover around the different geographic regions, and then it shows the different proportions and the number of adults. Higher purple means, the darker purple means higher levels, and then the blue or lighter purple area corresponds to lower levels. And then once again, we can see these dynamics at play by race and ethnicity. So once again, while these are like the underlying symptoms as it relates to COVID-19, the COVID-19 dashboard itself, so if you go to kingcounty.gov, COVID-19, that's typically what I type in the Google search engine. You will then navigate to this existing dashboard, so the COVID-19 data dashboards. So what we're gonna do is we're actually gonna move to the race and ethnicity dashboard, because that dashboard actually shows how COVID-19 has impacted different communities throughout King County by race and ethnicity. So we go here, and then I typically go to the distribution of cases. So if we scroll down some more, so here you can toggle between all cases as well as all cases excluding skilled nursing and assisted living residents. So if we want to take a step back and think about February, March, when COVID-19 first presented itself throughout King County, it was through the long-term care facility. So within King County, that was a lot of the work that was happening, trying to uncover and understand the rates within long-term care facilities. That includes like adult family homes and senior living facilities. You can do that, or you can do all cases excluding skilled nursing and assisted living residents. Because if we want to think that that's a unique population, right? Those who are like working in long-term care facilities, but those who are also residents in long-term care facilities, that might not necessarily be representative of the entire demographics of King County. I saw a orange flash button. Christine, is there a question that I need to clarify?
No, I added the link to the general dashboard page.
Thank you. Okay, so I typically toggle against like all cases excluding skilled nursing and assisted living, just to have a more representative sample of King County at large. But skilled living, nursing, and older populations, they are vulnerable to COVID-like illness too. So if it suits your cause, do all cases, because you're actually taking into account these older populations who are vulnerable to serious illness as it relates to COVID-19. And once again, just for simplification purposes, I'll just stick to confirmed cases. So here you have the percent of race and ethnicity compared to the 2019 King County population. So the darker blue bar corresponds to the percent of cases. So these are the percent of cases that have been identified as positive cases with COVID-19. The lighter bars are the percentage of the King County population. So if we just look at white right now, so the white population in King County, while they are 58% of the general population, they are about 35% of the positive cases in COVID-19. And then we scroll down to Black, right? So you have Black groups within King County, they are 13.6% of the positive cases, although they are 6.4% of the King County population. So using this data, we can say that Black residents in King County, they are overrepresented in the positive cases that exist with COVID-19. Similarly to the Latinx population too, right? The Hispanic Latinx population. Although they are only 10% of the King County population, they are 29.2% of the positive cases. And then we will scroll down to Native Hawaiian Pacific Islander. They are less than 1% of the population, but 2.8% of the positive cases that we see. And these are both the Vulnerable Communities Dashboard and the COVID-19 dashboard. Those are the metrics that are going to be used in order to see like which communities have been most impacted by COVID-19.
Oh, Vanessa, you just went on mute.
Okay, cool. I was like, Lynn, did I say something bad?
I was trying to mute myself question in the chat and I muted you, Vanessa. I totally apologize.
No worries.
Can I add one? Can I just add one comment before you ask the question, Christina? I just want to say also, we aren't just talking about those who have been impacted by illness, but what happens in your communities when there is a disproportionate number of cases in your community? Is there an impact on social isolation for your elders? Is there an impact on the ways in which you move around your community and you feel safe in your community? Is there a difference in the way you access healthcare, right? So even if people aren't necessarily like having COVID, what is the impact when there's a disproportionate number in your community, and really looking at those broader impacts of health access or the feeling of well-being. So making sure we have a broad view of health and how that manifests.
Thank you, Kai. And that's kind of what, when I think about COVID-19 and talking about COVID-19 and all, and just thinking about the impacts. So COVID-19, it unroots existing inequities, but it also exacerbates some of the existing equities, right? So it's coming at us from like two different places, and being able to show that and illustrate that in your applications, I think just gives us a better idea of like what our community needs surrounding the impacts of COVID-19 throughout our community. And Lynn, you can be the driver again.
Wait,
Go ahead, Christina.
Yeah, we have a question in the chat, and now I just, do the dashboards include any data on impact of COVID in communities by the intersection of race, ethnicity with immigration status? For example, immigrants or refugees?
So I do know that, oh no, sorry, did I do something wrong? So in terms of intersections, that is something that, this will stop screen sharing, no, okay. So in terms of intersections, that's a lot of the feedback that we've received from community. So right now there's this like isolation between like all of these different variables, but we understand that like communities of color, uninsured communities, communities at federal poverty, less than 200% of the federal poverty level, there is overlaps. And that's something that we're trying to just make sense of on our end. And your second question, I will take a look at that too. There's a lot of dashboards and there's a lot of information. So how it relates to immigrant populations and undocumented populations, there might be information, but I don't want to say yes yet. I'll navigate the dashboard and then get back to you on that as well.
Thank you.
Welcome. Okay. Lynn, if you can move on to the next slide, please. Okay.
There's one more question in the chat.
Go for it.
Just to recap, this grant will be, oh, go ahead, Christina.
I was just going to type in the response since we already answered it.
Oh, it's multiple orgs, right?
Correct.
Yeah. Okay, so now in looking at the data and like the quantitative data and how will it will like inform your research question or the community that you're working with, what are the elements of an effective research project? So while evaluation frameworks kind of give us, they focus on questions, methodologies, part of what we try to do at APDE is to try to make and try to get the evaluation and the research. I use those terms interchangeably, but I will focus on just focusing on research right now. These are the three things that we as APDE, we value in how we do our research and how we approach our different questions. So first, we want it to be equitable, right? And by equitable, we mean, and in King County, we mean leading with racial equity. You don't want to follow with racial equity, right? Like throughout the process and how you're planning your research question and how you're planning the tools that you will use to get the answers to your research questions, we want to be able to incorporate how can we make sure that we're harnessing and leveraging the information that community is providing us in the best way possible. And that happens in the planning stage, right? Making sure that you're taking into account the limitations and what are some of the tools that might be best suited for the communities that you're interested in. We also want it to be community-based and participatory, right? Community-based participatory research isn't necessarily saying that like community has all the answers. It is recognizing the role that community plays and acknowledging the fact that community does have specific expertise, knowledge in a way that we as researchers won't be allowed to have. And part of that is bringing and harnessing all of the different expertise of the individuals into a space where we can get the best bang for your buck per se, in order to explaining what are some of the in order to understanding what are some of the needs of community in the time. And you want it to be accurate and reliable. How do you make sure it's accurate and reliable? You have to make sure that you're vetting it among the communities that you're doing research with, right? So on my end, one of the ways that I'm trying to make sure that the information that we're gathering is accurate and reliable is that you do ground truthing with those communities, but also you do a report back, right? So before you disseminate these findings widely, make sure that you go back to those communities that you are doing that research in and collecting that data and ask, like, is this something that you think is accurate? Is this correct? Am I packaging your needs in a way that is like reflective and actually makes sense? And if you don't, like that is your role as a researcher, to take a step back and understand like what is it that you might have done wrong in trying to explain the findings that you're presenting at that time. And at the end of the day, you want all of these steps of the effective research project to be useful and actionable information. One of the differences is that you can publish stuff in like academic and peer text, but if it doesn't actually lead to changes and lead to movement within those communities, then that doesn't make it actionable. You want to collect that data in a way that's going to lead to some type of change and inform some type of policy or procedures that actually map onto the communities that you're caring about. Next slide, please, Lynn.
And we have a question. There's a grassroots group that is engaging weekly with the Ethiopian community around COVID. They don't have the capacity to run research, but have the population expertise to tell their story. How do they go about finding a research consultant?
Kai, I want to throw that to you.
That is a good question. I don't have a great answer for that, unfortunately. I think it's also thinking about, you know, maybe there might be groups on this call today that would be interested in participating that have more of that research capacity and maybe are thinking about similar communities. Yeah, unfortunately, we don't necessarily have a process in which we can pair groups with the research capacity. We are working, as I said previously, like on building more of this kind of capacity for community. And so Vanessa and her team, Communities Count, provides workshops where organizations can participate in to really build their research capacity of the organization. And I'm hoping that we'll continue to be able to offer funds like this in the future. So my hope also is that through the training that we provide, we're building the capacity of organizations to be prepared or to build relationships through those efforts. But it's a good question. I'm sorry I don't have more of an answer. Yeah, again, if there's anybody on here, feel free to let people know that you're interested in partnering. And then I will share with you at the very end what kind of technical assistance we have, and that could be an option as well. So we'll come back to that question towards the end.
And there's another question, and then I do want to confirm time if you're feeling like you're moving forward with the slides. Where did the question go? Do you have acceptable research measurements? What is acceptable qualitative and quantitative research? What is not acceptable?
So through this presentation, we'll go through some of those, some of the qualitative research instruments, but our Communities Count website actually has like workshops and has the workshops that we've created in terms of like what are some of the qualitative methods that we use as well as quantitative methods. And then throughout this project, and this is something that I know Kai will be talking about, Communities Count, our team will also be offering technical assistance as you move forward through this project.
We have another question. Can we use BSK consultants to help with data collection with this grant?
Kai?
Actually, Christina, I think we're going to be answering a couple of these questions as we move on in our presentation. So my suggestion is I think we'll get to some of these questions and then we can circle back if we don't answer them.
Great.
And I see connections happening in the chat box, so bravo, bravo. So this slide I'll just move through quickly in terms of like thinking about some of the challenges and concerns that you've heard about research and evaluation. So what we're trying to do is move from this conventional space where it's about like the researchers, it's about having credentials, the funders and the program managers, and more to a space where it is like indeed participatory, where everyone has a say and a seat at the table in order to understand like what data collection looks like, and then what are some of the ways that we can collect information from those communities that we're seeking information from. As Kai mentioned, this is a limitation right now in the terms of like, this isn't true participatory, this grant in itself, where community is driving what the research question is. And that's just something that we have to sit with, right? There's limitations in terms of like what funding is available and how grants are stipulated in terms of like that creates barriers for whether or not we are truly participatory. But we at King County, one of the things that we're trying to do is move the needle forward and trying to be as participatory as possible in how we're collecting data and how we're doing research within the community. Next slide, please, Lynn. So one of the things that I think is really helpful in thinking about a research question is like, what is your organizational capacity? One of the things, it's not just about data collection and how you collect the data. There also needs to be time and resources devoted to analyzing those data and trying to understand what are some of the themes that are generated as a result of that. This is not to say that there's not going to be like some unforeseeable circumstances, but I think as much planning as you can have done in the beginning, that'll help to alleviate some of the concerns or some of the issues that might arise later on in the project. Next slide, Lynn. So what is qualitative data? I showed you the quantitative data, and I think the quantitative data, that shows the what, right? It shows general patterns. It shows some of the general patterns that we're seeing in the community. Qualitative data and the need to harness and leverage that is it tells us the why. It provides insight and explanation in a way that the quantitative data is not going to be able to get at. So it's typically not measured. It can be done through interviews, observation, group discussions, and written document review. It's usually analyzed for themes through analysis, right? So whether it be stories or whether it be focus groups or whether it be like one-on-one interviews, you as the researcher, you as the person who's doing the analysis, you want to be able to have someone else to be able to verify like if what you're saying is true, right? We all bring our biases into how we do our work, how we do data, how we analyze data, and having at least one other person that you can confirm what you're seeing with kind of keeps you as like true to the nature of the research as possible. So it can be based on opinions, based on experiences, or based on perceptions. Next slide, Lynn. So here is the storytelling with data, right? Storytelling with data, it is a powerful way, like in a way that I might get like nerded out about like the quantitative data. There's folks that like, it's the emotions, it's the compassion behind the stories that's what gets to them. And that's what fuels whether or not they're gonna think about something or move through something. And some folks are just naturally more drawn to these emotional, powerful stories. And when you communicate in a way that combines data with an emotionally rich story, you become appealing to a broad variety of audiences. One of the things that me as a researcher that I think about is like, how can we pair the quantitative with the qualitative in a way to show this like very holistic story that feeds and reaches as many people as possible? Next slide, please. So what data to collect, right? I think that's one of the things. One of the things to data collection is understanding what is the goal of the data that you are trying to collect. So first, identify your research goal. You do not want to just collect data, collect stories, collect testimonials for people just for data collection's sake. You want the data that you collect to actually be data that's actually informing what your research question is, which is why you should let your research question guide the methods that you do to collect that data, but also what data you're ultimately collecting. Then you want to see the data and story elements. Decide what information will make your story compelling. Do you need convincing? Do you need to create context? So for me, the quantitative data provides like the what, this is what we see. And then you use the qualitative data to provide the context and understanding why we see what we see. And then ultimately you want to be able to put it all together. That's something that we're going to talk about as well. Data collection, data analysis, but then what does data dissemination look like in a way that actually reaches the broader audience that you're hoping to reach? Thank you, Lynn. So in this is one of the ways that we collect data, but also how we disseminate data. So in this slide, I will talk about the different public engagement, like how do you collect data? You have a controlled environment. And then these operate on a spectrum too. So you have a controlled environment, which is online surveys or feedback cards. So basically somebody goes online, this is after an event, this is after an event that happens, you have an online survey where you're asking questions and participants answer the questions in that way. You have a mixed environment too, right? So this mixed environment, it allows more tools to be brought in for you to understand what's going on within your community. So we have visual preference surveys. So one of the things that you can do is have like, you have like blown up documents, you have people walk around and put Post-it notes on in terms of like what feelings, what emotions, what patterns these start to uplift. And then these become a way that you collect data too. And then you have an open environment. This is where storytelling happens, where you're allowing the participant to be able to express themselves in a way that they can share the most of their insight and feedback within that. I also think one of the things that we need to consider is while some of these tools, a lot of these tools work, we are operating in a COVID-19 space, right? So thinking about creative ways and creative solutions to collect that data, given the fact that we are required to socially distance, to stay far apart. One of the things that could work, and like while I was reviewing one of these slides, is hopefully this happens on like a non-rainy day, right? The RFAs get approved, and maybe you can have something in a park where you put these like live action maps on separate trees and have people move around these different trees. And that might be a way to actually help facilitate discussion in this COVID-19 space. Right now, like Zoom calls are one of the ways that we are working a lot more. Using breakout rooms in Zoom calls is a way to do it. One of the ways is to actually have just written documents, right? Have folks write stuff down and send an email. That might be a new way of data collection that we wouldn't have considered before, but because we are limited right now, just trying to create different spaces and different ideas to move this project forward. And Kai, with that, I will pass it on to you.
Great. So just like Vanessa said, the data collection is a spectrum. We're also going to talk about the communication. So as Vanessa shared, we want this to have some type of action afterwards, action in a communication. So who do you want to share your findings with? Who's it important? Who are the stakeholders? And then what is the method? So similar, there is a variety of methods that you can use, similar to how Vanessa stated, there's the controlled environment where these take place and they're targeted to very specific groups of people, so social media or email blasts, or things can go down the spectrum. So these are just some types of communications that you might develop. You might be working on changing systems within an organization or within a school. And so some of these might look different than what is on here. We just want to share that there is a variety of communications tools that can be designed in order to meet that ask. So really, it's up to you, the ways in which working through, the COVID-19, as well as who your stakeholders are and the message that you want to convey. There may be different options. I think in the RFA, we identify like short videos or podcasts, as well as ways to be able to share out your communication. And next slide. So this one, I think we've talked about, and again, we want to share that this is a limitation that really our hope around community engagement is that we're moving all the way over to the right and empowering, and we recognize that with our timeline, with the context of COVID-19, and with even the funding amount, we may not be able to get all the way over to the right in terms of the ways in which we can engage community, but we want to try to find as many ways as we can to identify how community is shaping this process. They are participating, they are vetting materials, and they are engaging. So you can see this is, again, a spectrum. We really want to focus on ways in which we're involving, collaborating, and empowering community through this project. Next slide. So I want to acknowledge also the hard work of one of my teammates. Her name is Robin Hagwood, and she will actually be the project monitor for the projects that will be selected. I'm in place of her right now as her family's navigating multiple medical challenges. And so this was her slide, and I don't think I'm going to do it justice, but she really wanted to close our session with reaffirming that we all have a need for human engagement. The work of community to gather the stories, to use stories to influence is really an essential component of creating a strong community. And that we need to be looking for certain things when we're thinking about research of trusting community, trusting ourselves, that we need to have hope. It's hard to find hope in this moment, and yet I think there's so much resilience and ways in which our communities are pushing our structures, pushing our systems, not accepting the current environment that we're in. And so there's a lot of hope right now. And that, our communities are competent. We are whole individuals that have knowledge and skills to contribute to our broader communities and to furthering this work. And this all leads to a sense of worth. And so through this, we see this as a community building project, not just, again, data collecting and harvesting information from community, but really a way to invest and build that community strength and resilience and connection. Next slide. So this is our last slide. before we move on to a couple of the more requirement pieces. We think that, you know, this work cannot be done alone. We all have areas of expertise that we bring. We think that this work is actually best done in teams where people can use the skills that they have to amplify the, you know, the entire group, and that all people can be researchers. I saw some messages in the chat that this is potentially overwhelming or feeling like it's out of reach. And while we started with some of that quantitative, I want to just remind us that we can think about the scope of our project, we can think about the methods of our projects, and how would you create a project that does feel comfortable to you and the skills that your community has. Because our hope also is that this does feel like an opportunity to really use the skills in the community and the individuals that we, yes, all have components that we can bring, but there is rich stories and rich knowledge in our communities. And so all people can be researchers is the kind of takeaway for this slide. And all people have traits that they can bring around curiosity, particularly relationships, that's so key. And then just a willingness to learn and to reflect with each other.
And thank you, Kai, for that. I think one of the things, just to reiterate, is like defining that scope, right? One of the powerful things about community-driven data is that it's going to help to highlight certain things that the quantitative data never will, right? If we think about like smaller communities and smaller locations, harness that power and harness the fact that you are able to engage with these smaller communities that can oftentimes be overlooked by these large population-based studies. And I think that is one of the like strongest and purest value added of making sure that we're doing like community-driven data.
Thanks. Next slide. So I'm going to just go back to the questions here and see if there's anything that we didn't answer about our frame around community-based participatory research. Actually, Christina, is there anything in here that you feel like we should go back to that we didn't answer completely?
Related to just the research in general? No.
Okay, great. And again, if there are more questions, especially when we open up for questions, you can feel free to take yourself off mute and we can engage in a conversation.
And I will, so the one question about like what are some like acceptable, qualitative and quantitative. So I will pop in the communities count data workshops into the chat box. And those are just, I mean, we're expanding that, right? But just to give you an idea of like what we're thinking about different data collection, different ways to collect data.
Great. So I'm just going to go through some more of the kind of nuts and bolts of the RFA. So the submission requirements, there are going to be 4 attachments that you're going to submit to us. One is the cover sheet, and please make sure that you sign that. There is also going to be a narrative, and this is a maximum of 6 pages. We do want to make sure that you're sharing enough detail so that reviewers can have a clear understanding of your research question, your strategies, your team, and your approach. There's a demographic question that will help us to understand your community in which you're going to be doing your research, and then a budget template. Applications must be submitted by 2 p.m. on Monday, September 21st to Chris Diabro, and the email is there. And we want to make sure that we're very clear that we cannot accept late submissions. 2 p.m. is sort of a funky time, and sometimes technology things happen, so please try to submit before the 2 p.m. deadline.
There's a question, if you can explain a little bit what the cover sheet is for folks.
Sure, the cover sheet is in the RFA, and it basically just has a place for you to sign, and it has the contact information. So Christina, if you would drop the link to the RFA again, you can open that up and you'll see the cover sheet. So you'll just print that out from the RFA, as well as attachment 3. You can print that as well. And then the budget template is an Excel sheet that we have created. So you don't need to create your own budget template. You'll use the one that we've provided. Okay, next slide, please. So I want to spend a moment just talking about our application evaluation. So we have the criteria outlined in the RFA, and this was from an old slide deck, this page, so I'm not actually quite sure if it's page 11, if that got changed. So it may not be page 11, but we do outline it, and you'll see that there are points and scoring for each of the different components of criteria that you'll speak to or you'll write to in your narrative. The applications are reviewed and evaluated by a committee. We strive to include representation from our priority communities and funded partners in all review teams. So we actually have a review team of, I think, 7 or 8 individuals right now who have expertise either in community-driven research. There's a couple of what we're calling our COO community navigators. We've been working with community-based organizations, sharing and disseminated information to communities who are most impacted by COVID-19 right now. So a few of them are going to be on this review team. We have some people that have connections to COO on our team, some of our funded partners. And then we have one of our COO team members from the Seattle Foundation. Her name is Diana, and she does evaluation work with the Seattle Foundation and works with COO. But we really do strive to have a priority of community on our review teams. So all of these review members will participate in an equity training prior to the selection. We focus on the COO values and practices, and then we also think deeply about how our biases could show up in the scoring of this type of RFA, and we do that for all of our reviews. And there is the potential that we will ask applicants to participate in an interview if we need to gather more information for decision making. And often that's a pretty tight turnaround between when the review is taking place. And so pay attention on the timeline, your availability for those days when the interviews could take place. So we'll go to the timeline next. So just some key dates, the final day to ask questions, and you'll ask questions either here or directly to the email of Chris Diabro, which was shared on the past slide. Once an RFA is open, staff cannot answer information directly. So unfortunately, I cannot answer, Christina, Vanessa. What happens is you email Chris, and he will ask us and we will respond. And any questions that are asked during this time period will get posted to the addendum so everybody will have access to that information. This is a way of standardizing that everybody has access to the clarifying questions. So the final day that addendum will be published will be September 15th. So if you're writing, you'll probably want to just check in to see if there were any changes or any clarifying questions. The responses are due Monday, September 21st, before 2 p.m. I like how it says before, so 2 p.m. is the cutoff. And then we're going to be reviewing and rating the responses the end of September, and then those interviews will be scheduled the 1st through the 4th of October. We aim to notify our selected partners, new partners on October 15th. And I did miss a step on the application evaluation that's not actually on that slide, is that we do work with a governance group, and our governance group approves all of our funded partners. So we will have a governance group meeting in which the staff will present the slate of selected applicants that we are going to move to funding, and our governance group will approve those. Our governance group is made up of COO community partners, as well as representation from other community organizations, philanthropy, and King County government. The agreement will start on November 1st, fingers crossed. And that's why it's actually pretty important as well that you are able to identify your research question, because we are going to get started right away, as well as your lead. And then final slide, Lynn. So again, I've shared about the addendum, that if anything changes, we'll post that on the procurement webpage. Please make sure to read the terms and conditions of the RFA. If there are questions around the terms and conditions that you have as you're reading them, please feel free to email, again, Chris Diabro, so that you can ask any clarifying questions. Chris, do you want to just say hello and share if there's anything that you want to share at this point?
You can say hello. There's nothing more to add except just a reiteration of making sure we get those applications in on time. I obviously have no joy of rejecting or not being able to accept applications, and usually my advice is there's not much more that can be added in 10 minutes or 30 minutes that's worth not having the application accepted. So a day early, an hour early, but on time, please.
And we didn't have it on here, but we do have 2 consultants available.
It is on there, Christina. It's, sorry, the next slide.
Oh, great. Okay.
Yeah.
Great.
So then one email message to Chris with all of the 4 pieces of the application. And then last slide. Great. So we are, as Christine said, we are offering technical assistance to the application process. So I'm in the RFA, you can read more about who has access to this, but it's organizations with an annual budget of $2 million or less. The service is offered at no cost. Applicants can request technical assistance from now until 3 business days before the RFP close date. And you are suggested to reach out as early in the process as you can. Catherine and Roxanne are our 2 providers. And I actually believe, yep, Catherine, you're on here. Do you want to unmute yourself and go ahead and say hello?
Yeah, hello, I'm Roxanne, and I are super happy to support smaller organizations. You're the experts in your community and what you want to do. Our role is to help you get that on paper, and we can be helpful thought partners. We can help with the editing and reviewing, answering questions, doing some of the pieces. I would really add the earlier you can let us know if you'd like assistance, the better for all of us, rather than waiting to the last minute. It helps kind of, we have limited time on this project, so it helps us in understanding what our load is and what the best ways we can assist you. But please do use us for our support and you telling your story. So I'm happy to meet all of you.
Thank you, Catherine.
Yeah.
And actually, Christina had a suggestion that there was some talk happening in the chat. Christina, do you want to go ahead and, ask for the introductions?
I'm a little bit confused, Kai.
Oh, sorry, you had asked me if you think people that are looking to provide.
Yes, the chat about how to share the information. So there were some folks that helped inform people how to copy the chat itself, but we were wondering if it would be helpful for the folks that are some of the researchers that are happy to partner with community groups, that we could group that information together and send that over.
Yeah, does anybody who had volunteered in the chat box as a potential organization to partner with that has research capacity want to go ahead and introduce yourselves?
Oh, there we go. Before we do that, Kai, Jing Fong is a part of Roxanne's team, so it'd be great to have them introduce themselves as well as another one of our TA consultants.
Hi, this is Jing, and Roxanne was not able to be here today, but just wanted to introduce myself as I will be working with her to help folks do their applications. It can be a super daunting process, putting those together myself before, and as Catherine so eloquently said, the sooner the better, because when you go through this process for the first time, it just uncovers more questions. And there's so many descriptions, and we just want to make sure that everyone includes all the requisite pieces of information so that your applications can be considered and on time. So any questions, please feel free to contact Roxanne and we would be happy to answer your questions.
Okay, thanks, Jane.
You're welcome.
All right, Kai, wanted folks to introduce themselves. If you want to repeat that again. Sorry, the lapse in the chat and trying to get the information out. So we appreciate everyone's patience with our technology.
Sure. So Christina has suggested that there's some relationships happening in the chat and maybe people wanted to unmute themselves to go ahead. If you are an organization that has some, either it looks like there's some research capacity or communications capacity and you're looking to partner, do you want to go ahead and you can unmute yourself and introduce yourself?
I can start. Hi, my name is Angie Gaffney. I'm the most recent addition to the chat thread. So I'm at MEF Associates, and we're a small social policy research firm. As I noted in the message, we do a lot of qualitative research, interviewing folks who are participating in different social programs, primarily anti-poverty programs, federally, state, or foundation funded. And so, yeah, I think that I think this is a really interesting opportunity. I think what we would bring to a team would be that thinking about how to kind of plan the research and putting racial equity at the forefront and sort of working with the community organization to think through both the proposal, but then also the research activities. And yeah, I also noted we have some experience creating communications materials. So on the action side of the output, that would be something we would be really interested in helping out with as well. So I think I can put my email address in there, but you can also find us just by looking at MEF Associates in Seattle. So, thanks.
And I am hoping I can actually engage the group just for a second to get a question. It sounds like in the chat, again, people would like to do broader introductions. We have 45 minutes left. I also want to make sure that we're able to answer all of the questions. So could you maybe give us a thumbs up if you would like to introduce yourselves? Yeah. Okay, so we'll go ahead and do that. If you have further questions, though, go ahead and type them into the chat box so we make sure that we're that we're able to answer them. So we'll go through some introductions and then we can answer questions as well.
I'm happy to jump in as another evaluator researcher. My name's Kriya Miller, and I work at the Center for Community Health and Evaluation here in Seattle. And I think we would bring a real excitement to mixing qualitative and quantitative data. We've got a team of about 15 who have different expertise in those different areas. We also speak a variety of languages. And so if we're partnering with an organization that would want us to be on the ground intersecting with community, we can do that too. We could also play a background role, helping you think through the research questions and the methods and the products and communication tools. So we're experienced working both around Seattle and King County, but also nationally with lots of other community groups. We usually focus on health-based programs and clinical quality improvement programs. Thanks so much.
Hi, everybody. I can introduce myself now, if that works. My name is Salam, and Salam Muscano. I work with a group of other Ethiopian professionals here in the King County area, and since March of this year, we've been running a weekly Sunday community conversation and informational sharing and technical support related to COVID-19. So we started out very heavily around COVID and helping people understand COVID in Amharic, which is one of the largest East African languages spoken in King County. And there was sort of a lag in translation for people to understand kind of how to protect themselves. But because COVID was something that was impacting every sector, every section of life for people, education, jobs, income, mental health, we have built a program in the last 22 weeks consecutively that is responding to kind of what the community needs every week. And so there's a lot of people who are asking questions about unemployment, about virtual learning. And so the way we do it is we invite community organizations and public officials to come and speak to the community directly and helping to understand what the resources look like and how our community can best be supported. I have a public health degree, and I have an interest in community-based participatory research. However, because I'm doing this as a volunteer, I don't have the time to take that on, but there's just a lot of stories that we're hearing that are just not captured anywhere in terms of the lived experience of folks right now as they're dealing with COVID. And we would like to partner with someone who has the time and the capacity to help us think through this application, but also help us run the actual research too. And we have the population, we have community members where we have very strong relationships. We just don't have the time to devote to this because we need to just run the program every week. So I'm Salam, and I put my email down there as well. So I hope to connect with some of you guys if you're interested. Thank you.
And hello, my name is Pamela Oakes, and I am the managing director of the Profitable Nonprofit. I am originally from Seattle. My background is in working in nonprofit fund development and diversity, equity, and inclusion. I do a lot of work with organizations both domestically and internationally. My background is coming from the Bill and Melinda Gates Foundation. I worked there for nearly a decade, surprisingly, that long. And I also have background, I do a lot of community engagement work now on a very large scale, and have previously worked internationally in Johannesburg, South Africa, in post-apartheid Johannesburg, in doing diversity, equity, and affirmative action, gender equality, and employment equity work for the top corporations in Johannesburg, South Africa. So sounds like a very exciting project. Working as a consultant, I do have a background in data measurement and evaluation, but would be very open to other organizations who might have more data science background and technical assistance than I currently possess. But sounds like a fabulous project, and I'm excited to be able to participate on it.
Hi, I'm Lisa Hayward, and I co-manage the Community Engagement Core for the EDGE Center at the University of Washington. EDGE stands for Exposures, Diseases, Genomics, and Environment. And we have money from NIEHS to do work related to community-based participatory research. So we have capacity to do videos in multiple languages. We came up with videos in 9 different languages when COVID was first a thing back in March, to give people the basic information about the disease. We did a series of videos working with fishers on the Duwamish River, and we did that in 4 different languages. So we have video capacity, we have a real interest in podcast development, and a lot of research expertise in social sciences and in public health research. We're in the School of Public Health, if I didn't mention that. And our staff time is covered by our funding from NIH and NIEHS. So we could bring a lot to a partnership that way, just in terms of capacity at the University of Washington. And I'd be happy to talk with any groups who are interested in partnering. That would be great. My email is in the chat. You can find it there. Thank you.
Hi, my name is Mario Zabaleta. I'm a business owner, a small business owner from Latino Northwest Communication. We are a video production company and content creators, basically in Spanish. And since March, we have been producing content for King County and for the city of Seattle. And also producing content in different indigenous language from Mexico, especially in South King County. We have a lot of experience working in the state of Washington, working with farm workers and different groups of the Latino community, especially from Mexico. And we are the media part of this project. We are talking with 2 different Latino organizations. They are interested to partnering with us. So we are going to be creating if we get them funding, we are going to be creating all the videos and all the material for them. But we have been working with CIMAR and Consejo Consular and Referral Service. They are the well-known organization in the Latino community in the state of Washington. So we are going to be working all together. And if anybody needs any information from the Latino community, we are very close. We have been working very close with them.
Thank you. This is where I'm realizing this is like what the after meeting normally is like when we do information sessions, where everybody can mingle and talk and share and network. And so I'm really sensing that loss of when we're in person. I'm glad that we can share that here. I see that there's some interest in sharing emails, and so if you are wanting to get this, the chat, and you want to put your email in, we'll send the emails to the people who are wanting to share their contact information. And I just want to circle back and make sure that we're also able to answer any questions that might still be remaining about the RFP or the application process. And again, if there's anybody else who wants to chime in and say hello, you're welcome to do that.
We do have a question that was brought up before. Can we use BSK consultants to help with data collection with this grant?
That's a good question. Vanessa, do you have a thought about that?
Yes, that is the thought. That is the answer to that question. You can use BSK consultants.
Yeah, and COO also, because we have a capacity building component, we want to see our partners have success. And so part of our capacity building is to acknowledge that we're all learning and we all have different strengths. And so really thinking about how do we create resources for our partners to help them in the current projects that they're in. So if things emerge as the projects are underway, we do have mechanisms within COO to provide either some coaching support or, again, that critical connection to relationships or capacity building workshops. Again, the coaching through the BSK consultants is available as well. Are there any other questions? Or anything that anybody would like to share with us?
Another question in the chat: what are the future plans of the funder agency once we have collected stories and data?
Great. To be honest, that is actually really about the project, yeah. Right? So who do you want to share your stories with? What is your purpose in collecting those stories? Is it to help to advocate for policy or system change? And that really is kind of the focus of COO. But are they maybe smaller changes in the ways that you are community building through your organization? Or are you documenting the resilience and the new strategies of caring for each other that we're seeing right now to help to develop best practices for emergency response that you would want to share with the public health department? This is how you could do this better next time. So we as COO really want to amplify and share your stories. There's a couple of ways in which we can do that. We have access to multiple blogs. So Seattle Foundation, Best Starts for Kids, Communities of Opportunity. You can leverage our platforms to share out the stories that you're collecting. There's also a speaker series that we're hoping to get started with COO. So there are ways that we can potentially plug you into some of the platforms we're developing. There might be, a training or a workshop that you want to do with other organizations or community members. And then I think lastly, there is this idea of a Communities of Opportunity Summit. And this is where I see a culmination of a lot of our learnings. How can we share our learnings together and celebrate them, but also organize around what some of the next steps are? So again, the data, the stories don't belong to us, they belong to the community. We should be seen as an avenue to help to amplify community voices.
Great, well said, Akai. There is a question. I understand $100,000 available in the RFP? Is there a limit in the number of proposals? And the second question, do you feel there might be a second round?
So my dream is that, yeah, we can maybe actually get some more money. Right now we are at 400,000. There is, I think, the opportunity kind of, one, BSK is up for renewal, and we only have confirmation of funding until 2021, which is why we have that 2021 date. Hopefully we'll all continue, and we'll continue to do this work. There are resources though that are popping up, and we will continue to try to, I think, draw a connection to the work that we're doing, especially if we receive some really great proposals and we're not able to fund them all. We will, with your permission, ask if we can share these with potential other funders, or really try to find a way to, to advocate for similar funding. So unfortunately, I don't have a confirmation that there's more money or a second round, though our hope and intention is absolutely that we will try to expand and grow and continue. And thanks. A new funding for sustainability of projects the community will propose. Yeah, so again, I see the learning community work as a way to introduce groups to our other strategies, which I shared earlier in this webinar. We have 2 other funding strategies that are really about funding long-term projects around policy system change and place-based work or cultural community work. So there is the potential, I think, that this is really a jumping off point to some of our other funding. And I saw a new introduction in the in the chat box. Great, thank you.
Yeah, it's great to see the collaboration and people saying, hey, if you know anything about this particular community, reach out to me. Yeah, really just appreciate it, and it's part of our work in helping to make these connections and work together to share the stories and make the change.
So I see, oh, great. Thanks, Helen. Helen wrote about sharing project info and proposal submissions takes time and resources, especially for community-based organizations. Yes, absolutely. I definitely recognize, and this is something we've thought about. How do we honor the labor that goes into the writing of proposals? And just the thinking about it. So we want to try to really minimize the length of application. So it is 6 pages. You don't have to meet that 6-page limit though. You don't have to write to get there. If you feel like you're able to answer all those questions in 3 pages, that's okay. So I'm seeing less kind of movement in the chat. If you are going to be logging off, feel free to go ahead and do that. If you have other questions, I'm happy to stay on. Vanessa, Christina, and I are scheduled to be here till noon. But otherwise, thank you for joining us today. Thank you for sharing your reflections about the RFA and the opportunity, as well as your introductions and willingness to partner and connect with each other.
I had a question. Oh, sorry.
Just want to ask, by when could people expect that the recording would be up on the website? There was a question.
Yes, the recording is usually up within 3 days, so I would anticipate probably by Monday. We kind of edited it down. We had some tech problems earlier. I think that all got recorded, so likely Monday.
Thank you. Thank you for this presentation. This is Salam. I had a question. I think I missed the very beginning, so I feel like I'm missing some basics. So how much money are you, what's the funding? How many people or how many organizations are you hoping to fund? I think that's the basic. Yeah, that's what I wanted to know.
Thanks. Yeah, we have 400,000 allocated right now. The maximum amount for any organization, group, or team would be 100,000. And the timeline is really dependent upon the project. We hope that funding and contracts will start November 1st, and they have the potential to go until the end of 2021. So it's about a year long, and you can request less than the 100,000, which is why we're anticipating potentially 4 to 5 applications funded.
Okay, thank you.
Hi, everybody. My name's Cynthia Kurtz, and I joined this call because one of my colleagues sent me the link. And I work in an area, it's called participatory narrative inquiry, which is kind of very connected to everything you're saying here. We work with stories and communities, and so I just want to, I mean, I mentioned it in the chat, but if anybody's interested in connecting, I have a free textbook and free software that is connected to how to do this. So if anybody's looking for a method they can use to do these things, this will work for that. And I'm happy to talk to anybody, give you advice or whatever. I've coached a lot of people through projects, so I'm happy to work with anybody on that if they just want to talk about it. So.
Thank you for that offer, Cynthia. It looks like maybe there's a couple other people off mute. If you're interested in asking a question and you're off mute, you can go ahead and ask a question.
Can I ask a question? So I really appreciate this talk of partnership, and I think, yes, we want research, but like the little r, right? Like not necessarily the big R. So I'm kind of curious from the organizations who are still here. I guess, what are some of your hesitations, right? Like, is it like not having an evaluation data person, or is it just like the scope of the project seems like expansive? Just to, I think, just inform how we're thinking about like capacity building for our partners in the future.
I can chime in. I'm Salam, and I'm doing a sort of grassroots group, working with a grassroots group to inform the Ethiopian community on various COVID-related resources. We started this project of informational project because we just saw that there was such a huge gap, and so it was sort of like an emergency, like we need to step in and give information type of start. And then COVID lasted a lot longer than we thought, so we're like in this position. Yeah, so we're so I think part of it is like we're pretty tired, but we're like, but we can't stop giving out the information because now folks are relying on us to provide this information. And I think the challenge for us is, you know, we want to keep doing the work that we know is the community needs, and then this seems like it's something the community needs, but like if we really had to choose, like we would just keep doing our program and not stretch ourselves to a research. And at the same time, that feels a little bit, it doesn't feel great to me because I'm like, oh, this is such an opportunity to make sure that the people who are most vulnerable and most kind of out of the loop, if that's a thing, like way to say it, these are the people, this is the population that actually really needs to go out there and be heard, but we just need to keep doing this basic thing that people actually need. So I'm feeling a little conflicted about great opportunity, and I'm like, I don't want to like I don't want the quality of our program to like get reduced or our capacity to get stretched out. Do you know what I mean? So that's my challenge.
That makes a lot of sense.
For sharing that. Yeah.
And for me, I can just kind of piggyback on what Sam said, is that for me, I do a lot of work with organizations led by people of color. And that is where my passion is, to ensure that the voices of the people of color in this area are heard. And so as was mentioned, that you know, some of those underreached, underserved community colors are most affected by COVID. And yet those are also the organizations that don't necessarily have the capacity for the research. So my concern, or it's not really a concern, a hesitation, is that I'm glad to hear that there'll be more than just one organization who gets it, because if it was, my experience with this area is that it would go to the typical usual suspects who are not people of color, and yet who are doing work that impacts communities of color. And so my concern is not necessarily it's the research capacity, but also that that the opportunity is there for organizations led by people of color are part and parcel of this work. And that is why I'm here.
Thank you for that.
I have a question, and this is not as a technical assistance person, but someone who has just spent the last dozen years working for a media organization doing education outreach. So my question is, to jump off of what Pamela just said, is that when you've got a community-based organization who has not been represented or has not had their voice heard, definitely has a voice, but not had their voice heard, and you've got this research component and a storytelling component, the research part that kind of threw me off, that made it sound like the big R, as you said, Vanessa, was the data analysis. And so when I see that part, and a person in a community may have dozens of stories and knows inherently what is there, but they may not have the numbers to go with it. As you partner with a research organization, my fear would be that so much of the work would be in the hands of the researcher, that the community members themselves feel like they're, once again, giving their voice to an expert, and this is no diss to researchers, but they're really handing over and trusting that person. And I love that you asked, Vanessa, you asked that whoever does the research, ask the community, did I get this right? And then you've got the storytellers, and you have storytellers in your own communities, but if you have a storyteller as part of your team, whether it be a media organization or another nonprofit, again, you're having an expert and trusting that person or that organization to tell your story. So what I heard was that the county places paramount importance on that this be a community-led project, and yet these communities are relying on or teaming with quote unquote experts. So as you're looking at these proposals, what is the balance, and how can one be ensured that the community is really the one in power and the one in control? I hope I articulated that okay. And I just shoved that question out there because that was what was gnawing at me. Not as the TA, but as the person. Okay.
So the question is about the criteria and how we would look at the partnership. Or
it's not just the criteria. Yeah. I guess it's just the nature of the project. You know, so as people put together their teams,
yep.
You know, really, I hear you saying that the community that is impacted negatively or disadvantaged in this COVID crisis is the one who's really the lead.
Right.
And yet you've got these research and storytelling components, because in the end, that's what you want your project to be, is to share their voices, their stories, but also have data behind it.
Correct. Yeah, so you know, we shared that the spectrum of community engagement, right? And we would really want to see that there's, to me, the empowerment stage. If there's a partnership, we want to see community in the driver's seat. We want to see community having the decision making. And if there's a research or communications more, you know, technical assistance, it's providing support. It's not driving. It's providing maybe some learning and engagement, and maybe some question asking, helping to, but they're really seen as a support, not as like the main, again, driver of this project. And so we'd look for that in the narrative. What is the nature of your partnership? What is the expertise that community brings? And how is it that these other technical assistance providers are amplifying the expertise of community? So that's what we would look for, because, I'll be honest, partnership is really hard. We're finding that in a lot of our work, and especially if we're looking at new partnerships, it takes a long time to understand the power dynamics and how you work together. And so we'd want to see that there's a clear description of what the value add of the partnership is that empowers community and doesn't detract from the leadership of the community.
Yeah, kind of to piggyback off what Kai was saying, I think that's why I tried to make a point, just to limit the scope, right? Like the smaller the N, that creates a space where the CBO actually is the driver. Because I think what happens is that the overwhelmingness of trying to capture everyone in that population, that becomes a thing. So yeah, I echo, I agree with everything both Jing and Pamela are saying, just making sure that it is community-led and community-driven. And just for me, as a researcher of color, I don't want it to, I want it to be something that people of color actively and consistently are engaging in, and to expand this conversation. So that was Vanessa speaking. Now I'm back in my county shoes, so I'll hush.
I'm also really thinking about when we have the slide, meet people where they're at. So if you're right now, and I really want to honor the exhaustion, the work that community is putting in right now. There is a lot going on, and a lot of us are honestly just trying to, keep it together. So where are you right now, right? Where are you working with your community already that you might be able to ask them some additional questions? If you are delivering groceries, are there ways in which you're adding in a couple of questions at the end of that delivery drop-off that can help to identify how you are, connecting with them around whatever your research question is? Is this helping around food insecurity? Is this building connection to community? Is, your community-based organization providing an essential role that institutions or government are unable to provide right now? And you're able to capture that, and then you're able to share that later with policymakers around the importance of your community-based organization and, leveraging that for some type of change. So again, where are you already at where you could add something on so that you are capturing the impact that you're providing right now, and not creating kind of a research question that's outside of your scope of work, but maybe building into that. And I don't know if that's something maybe that also the TA providers could help with around creating that type of question around identifying what is the research question that you have around the work that you're already doing right now and the impact that you have.
Yeah, and I think, Kai, that's probably something that we can add in the slides that we're putting, just to make it, I don't know, just to define the scope a little, finite it a little bit, just for folks who aren't here, and to just yeah, I just feel bad. I don't want the CBOs to be oh my God, this isn't something that I want to engage in. And we exactly, specifically what you said, want to meet folks where they are, instead of trying to create something that they can't even see themselves in or participating in.
Vanessa, could you give some examples of types of questions? So again, this doesn't mean these are the exact questions that you need to do to apply for this, but what are possible questions that then people could see the different ranges of work? I feel like that might be helpful.
There are a couple that are actually in our RFA, so I can read those ones. So what are strengths and barriers present in our communities that have led to increased or decreased health outcomes? Another one, amidst the high levels of unemployment, what structures have been put in place to support our community's economic survival during COVID-19? And this was actually taken because we've seen some of our COO partners really supporting the businesses that they're working with. And so being able to capture that as a strategy that has really been able to root the businesses to withstand this crisis. What are examples of resiliency that we've seen in our communities that has supported individuals and families during the governor's stay-at-home order? How have individuals at risk for loss of housing continued to remain sheltered despite the lack of ability to pay rent? Again, like this was kind of identified from some of the strategies that we've seen come out of community, where community has created these funds to be able to support artists or specific community members that are not able to access other funding strategies. And then last, how has community come together to support health and well-being of children during this time? And that can be examples of ways that you've shifted programming, or you've been able to build community with other parents. You know, and I think that one as well could be around supporting elders in the community, or folks who have disabilities who were unable to leave their homes during the stay-at-home order, and even continue to not be able to remain as mobile in our communities. And it looks like, Salam, you had taken yourself off mute and maybe had an addition.
Yeah, I was, you kind of got at it, but I was kind of wondering about, you know, the program that I run, just like many sort of grassroots groups, you know, it's sort of like, how to say, I think I heard, last I read, there's like 13,000 Ethiopian-born people in King County, something like that. And I think that number is probably higher now because that was older data. You know, we're not reaching 13,000 people, like, because of many, many reasons, one of which is that we are just a volunteer-run organization. So how do you, and then when I think about back to my grad school and research, I'm like, oh, you know, a representative sample and things like that. I'm like, that's partly kind of overwhelms me. I'm like, well, I can tell you about the people who've been coming to our program, and they represent different, you know, population, but I can't tell you about every Ethiopian that lives in King County. I just can't do that. So I'm struggling with that a little bit.
Do you want to speak to that, Vanessa? I have a response, but maybe you can speak to the question around kind of.
So I think, like, that's why I say, I think that is the strength of community-driven research, right? Like, you're going to be able to get at like patterns and stuff that's going on in the ground that the population level is never going to be able to capture or get at. So just because like the small sample that you're working with doesn't necessarily map onto like the 13,000 Ethiopians, that's still valuable information for us to understand what are some of the basic needs that these community members have that we're not meeting. Because at the end of the day, even if we were to do like our population level sample is not going to collect all 13,000 Ethiopians anyway, right? So just understanding that there's like strengths and weaknesses of the quantitative and the qualitative. And the reason why, like the way that I conceive of the two is like quantitative shows us the what, right? The what is the 13,000 Ethiopians, and then the why and the how is those like close-knit interpersonal relationships that you have within your organization.
Thank you.
I would also say, Salam, you know, if we're looking at kind of system change, right? Like, what can you learn about the ways in which you've been engaging with your community that is helpful for other people to learn from? So even if you haven't impacted all 13,000 community members, have you impacted 50 and you've been able to meet them in a different way in a crisis that other people can learn from, and that we can actually move suggestions to policymakers or to the public health department around how do you work with community in a crisis? I think, you know, when I was back in public health school a long time ago, there was a windstorm and there was a crisis around communities moving generators inside the home. And it resulted in the death of multiple community members in the Somali community. And from my understanding, a lot of this was how the Somali Health Board was born, because they learned that there were not the resilient, culturally community-based organizations that were needed to respond in that emergency. And I think, again, we're learning a lot about what are the impacts of COVID-19 and how we need to have the response at various levels to be able to support our communities as we move through this.
Thank you very much.
Okay, we have 5 minutes left. Again, I just want to reiterate, we really want to focus and center on community voices, community research, little r research. We have support through our TA providers. There will be support, especially if there are groups that are feeling like, you know what, I'm not ready to apply. Connect with us afterwards. I'll type my email in here, and we are building these workshops through Communities Count to build community capacity around research and evaluation. And so you may not be ready at this stage, or you may not have the capacity, but there's ways we can stay engaged and connected and help to build that future capacity so that when we get to do this again, you'll be ready. So thank you for joining us. Thank you, Vanessa, for your presentation and expertise. Thank you, Christina, for facilitating. Thank you, Lynn, for helping with the tech and taking notes. We also will be sharing all of the notes as an addendum. So if there were things that we went over, you want to go back to, both the recording and the questions will be posted hopefully by next Monday. And thank you all for joining us and spending your morning with us.
Definitely.
Can I ask one more question?
Yeah.
Love you. You're great.
Go for it.
I was thinking about, like, you know, because this is somewhat of a quick turnaround, so I can imagine that there be other organizations, you know, that serve African populations, like the program that I run, and we're like, oh, you know, and we all just sort of, let's say we apply separately and we're trying to do different things, and let's say only one gets picked or whatnot. If like, let's say even like, let's say I applied and we focused on East African communities or whatnot, we get picked. Is it possible to then say, you know, well, we also do want to hear from, let's say, the Somali community, not only Ethiopian community, and try to do it that way? Or do you think that it's better to just sort of to stick to whatever you wrote initially? I guess able to go out and sort of, you know, connect with other African serving organizations besides the ones that were on here today. I just thought about that. I don't know how that works. Yeah.
I think that's a great question. I see that there's a couple of limitations in the way that we've developed this RFA that would be challenging for that. One, just the amount of money and the timeline, both in the application and in the completion of the project. We normally really do want to focus on partnership work because of the kind of limitations of this RFA. I think it's really up to you around the capacity that you have. You know, I'm thinking now, should we have created like a mixer or something for groups? And I think this is such good learning for the future. But I think there's a couple of components that would make that challenging. $100,000, especially if you don't have full-time staff people already being funded to do this work, it could be really limiting with that amount of money. And we definitely have seen how when we're not able to fund a project at the amount of resource that's needed, it can be challenging for the groups. But if you feel like you have the capacity, I think that would be helpful. I also would say that you know, there's ways in which we could help to build conversation and sharing into these projects. So as you're moving along in your project cycle, there might be ways in which we could, as learning community, help with some of those critical connections, or help with sharing, or help with, you know, what would be important to share out in the broader community around what your learnings are, your findings, or to gather some information.
Yeah. Okay. Awesome. Thank you.
Okay. Thank you so much. We will be staying on as staff to just do sort of a check-in, but I appreciate you all sharing your time with us this morning. Thank you so much.
Thank you, everyone.
Can we stop recording, Lynn, or I'm not sure who's controlling that?
You can pause it.